You do matter to us here, and May is Mental Health Awareness Month. According to the CDC, the number of young people reporting poor mental health is on the rise. We're joined by the Director of Behavioral Health at Blue Shield of California, David Bond, to talk more about what parents can be on the lookout for. Thanks so much for being in here. Really important conversation to be having. Can you talk about some of the numbers and why we're maybe seeing this rise?
Yeah, well, I would say mental health, it's more than just what's going on inside somebody's head. It's
Sure.
all about the person and the environment that they live in. We're talking about the financial environment, the political environment, and social environment. You take in international conflict and things
Right.
going on at home. All these things are really impacting, especially young people, but it's pervasive issues going on throughout the country with all of us.
Yeah, so coming out of the pandemic here, there was a huge mental health issue. Has that just kind of continued into the years post-pandemic?
Well, the stressors haven't really changed a whole lot. I got to tell you, though, that when the pandemic happened, one thing that really changed is the stigma in talking about mental health. People are talking about it in ways that they hadn't before. And it's becoming much more common for people to check in with each other and have that language.
Right.
And that's a good thing that's come out of it. But we still have to figure out how to build that resilience for dealing with the stressors that are all around us.
Absolutely. So we have parents watching right now, may have young kids or teenagers that are maybe going through some things. What can they be on the lookout? How can they protect their children? How can they keep their family safe in this growing crisis?
You know, I'll tell you, I get that question quite a bit.
Yeah.
And I'm going to give you the same thing that I would even tell a young therapist starting out. It's the same thing that therapists do. You don't have to know what to say. You need to know how to listen better and really engaging in conversations where you're allowing enough silence for someone to really talk to you about what's going on with them. So for parents, I would say when you're working with your kids, whether they're teenagers or younger, it's okay to make an observation about what you see going on and ask a question like, how are you doing? How are you dealing with that?
Yeah.
Or what's that like for you? And then stay quiet long enough for them to really talk to you about something meaningful.
Even that awkward silence can eventually be enough to kind of break through. I know my son's a teenager now, right? So I'll ask, I can tell something didn't go maybe great at school. I can ask him, hey, how's it going? How's it good? And I just know it's not good. So if you wait long enough and you ask, sometimes you get a little bit more. How much and intrusive are you expecting parents to be?
Yeah, well, I have three thoughts about that one. When you're talking to a young person, especially a teenager, about mental health, I would really suggest sit beside that person, not necessarily front to front, face to face, and don't force the eye contact. When you force eye contact with a young person, that's also the posture that a parent takes when that young person is getting disciplined.
Sure.
So you're gonna make me talk about something that's complicated. Maybe sit side by side is one tip. The other piece about it is that when you're asking questions like, what's up or how is your day, you're going to get a grump response or you're going to get a one-word response too. So I would say ask a little bit deeper of a question like what was the best thing that happened today?
Yeah, good.
Or something like, what kinds of things stress you out? What kinds of things are weighing heavy on your mind? Or are there any things that keep you up at night?
Yeah.
To try to get a little bit more than just some of those one-word questions.
Yeah, interesting. The phrasing and making sure you ask the right question. And then the listening component, very important, like as you pointed out. Where can people get more resources and additional support? I know there's a lot of help out there. You just got to be seeking it, right?
There is. If you know what you're looking for, you can absolutely find it. At Blue Shield, we have some specific resources for for students and parents and adults who work with students, and that's on our Blue Sky webpage. And then also, there are so many resources. I want to make sure that your viewers are left with, if somebody is actually experiencing a mental health crisis, that 988 it's the 911 for mental health.
Gotcha.
And so it's the right place to start. Even if it's not an emergency right now, but you're like, I need some resources and this is really important and timely.
That's a great way to step in.
Go ahead and give it a try.
David, thanks so much for sitting down with us. Really appreciate your time.
No, I'm glad to be here. Thank you.